Hi, my name is Shirley Valencia. My topic is sodium zirconium sarcosilicate for oral therapy of severe hyperkalemia. Definition: hyperkalemia is defined as a rise in plasma potassium above 5.5 milliequivalents per liter. It is an electrolyte that can lead to further clinical complications, the most serious being cardiovascular and muscular. It is the consequence of a decrease in the renal elimination of potassium, body distribution from the intracellular to the extracellular space, or an increase in the contribution of the ion.
Okay, our next patients dealing with hyperkalemia, which is the condition of having too much potassium in the blood. And in this condition, you see blood potassium levels that are generally greater than about 5.1 milliequivalents per liter. And the individual in this case is feeling quite uncomfortable. Fatigued, and in terms of the heart, there's irregular pulses, a widening QT wave on the EKG, so that indicates the risk for cardiac arrest. The stomach, very uncomfortable, and you see GI upset, which includes diarrhea. From here, the loss of potassium, the excess of potassium can go on to produce tingling and numbness in the extremities, and then muscle cramps and weakness in the legs. The kidneys are the next thing we're going to talk about being affected, and they begin to fail. So the consequence of that is change in the amount of urine output. Question: what are the nursing actions? Excellent cardiac assessments. This patient may even be in a monitored unit. Frequent neuro checks. Accurate intake and output. The use of potassium wasting diuretics like Lasix, and the restriction of dietary sources of potassium. So this person's not going to get that extra orange juice or banana.
Application in medicine. Sodium zirconium cyclosilicate captures potassium through the gastrointestinal tract and reduces the concentration of free potassium in the gastrointestinal lumen, thereby lowering serum potassium levels and increasing fecal potassium excretion to resolve hyperkalemia. Sodium zirconium sarcosilicate begins by reducing serum potassium concentration with 1 hour of ingestion, and normalkalemia can usually be achieved within 24 to 48 hours. Pros and cons. Pros: sodium zirconium sarcosilicate does not affect serum calcium or magnesium concentration or urinary sodium excretion. It is effective and safe for the treatment of hyperkalemia in patients with end-stage renal disease or hemodialysis. Cons: sodium zirconium sarcosilicate is not absorbed or metabolized by the body. Sodium zirconium sarcosilicate can temporarily increase gastric pH due to the absorption of hydrogen ions and can modify the solubility and absorption of the drugs.
We have 1 critical minute to focus on the ECG changes in hyperkalemia. Let's go. The first changes that occur as potassium levels rise are the peaking of T waves. Next, the amplitude of the P wave decreases and the PQ interval increases. The QRS widens severely. As potassium increases further, the shape of the QRS segment and the T wave become more sine-like. This is highly associated with ventricular fibrillation and with that, cardiac arrest. If you have a patient with hyperkalemia that has a wide QRS segment, keep them on the monitor at all times. For more information on hyperkalemia, including treatment, watch my video on it. You are dismissed.
Issue applied in Ecuador. Hyperkalemia occurs more in patients with chronic kidney disease, and in Ecuador it's covered about 30%. In relation to the behavior of chronic kidney disease, according to age group and sex, there was a predominance of men over 60 years of age. Conclusion: hyperkalemia is frequent metabolic alteration in patients with chronic kidney disease that increases in the presence of drugs with beneficial renal properties, so that in many cases patients lose the benefit associated with these drugs.
You or someone you care about may have been diagnosed with hyperkalemia, a problem in which too much potassium is in the blood. This video will help you understand more about hyperkalemia, including its symptoms, common risk factors, and management. There are often no symptoms of hyperkalemia. However, mild symptoms that appear over time may include nausea, muscle weakness, numbness, or tingling. More severe symptoms that happen suddenly and require immediate medical care may include shortness of breath, heart palpitations, chest pain, nausea, or vomiting. The body needs to keep the right amount of potassium in the blood for nerves and muscles, including the heart, to work normally. Potassium is one of several minerals that the body gets from food. Most of it is stored in the cells of the body, and a small amount stays outside the cells as well as in the blood. Healthy kidneys help to maintain normal levels of potassium in the blood by passing excess potassium out of the body in urine. There are risk factors that may damage or impair the kidneys or prevent the body from keeping potassium in its cells, leading to hyperkalemia. Some common risk factors for hyperkalemia include chronic kidney disease, a condition where the kidneys gradually lose their ability to work properly. Heart failure, a condition where the heart has trouble pumping blood to the rest of the body. High blood pressure or hypertension, a disease where the force of blood on the walls of the arteries is too high and may lead to complications like chronic kidney disease and heart failure. Diabetes, a disease where too much sugar is in the blood. And taking medications for these or other conditions which may prevent the kidneys or the body from maintaining normal levels of potassium. A doctor may do a blood test to check the body's potassium level. For most people, a normal range is from about 3.5 to 5.0. Hyperkalemia is a potassium level greater than 5. If you are at risk for high potassium, speak with your doctor about ways to manage your potassium levels. You may be asked to avoid or limit eating foods that are high in potassium. In addition, your doctor may make changes to your medications. To help minimize your risk of hyperkalemia, it's important that you know your risk factors, potassium level,